Hello, my name is Roman Richardson, and I'll be doing my project on physician-assisted suicide. So a little background on this. Physician-assisted suicide, PAS, sometimes known as physician-assisted dying, is when a doctor or physician facilitates a patient's death by providing them with the means of information or means to enable them to perform the life-ending act. Sometimes this gets confused with euthanasia, which is where a patient or a physician or doctor will administer the lethal medication to the patient themselves. PAS is when the patient chooses to do the act himself or herself after the doctor or physician has given them the information or prescription needed to do the act. So a doctor will sign off on some sort of prescription, or they will give some sort of medication that will cause a patient to die from it. So uses, PAS is legal in several places, for example, Oregon, Switzerland, and Canada. It is used for very terminally ill patients experiencing large amounts of suffering, lots of pain, many times where they can't recover from it, where they know that the pain is going to get prolonged, it's going to continue. It's a way to end their suffering without having them to go through that pain anymore. Advancements in technology, it may allow doctors to predict incurable suffering earlier, expanding the criteria for PAS, eventually being able to track a patient's pain or quality of life, which can help determine if a doctor should use PAS or decides not to. Its origins, it's been going around for a long time. Early 20th century, here's a more recent one. The first significant push for this legalization happened in the US. It emerged with debates from states in Iowa and Ohio. Eventually, in the 1980s, the Hemlock Society advocated for the right to end one's life peacefully. It was founded. 1990s, Dr. Jack Kevorkian gave notoriety for assisting in numerous suicides, bringing the issue to the forefront of public debate. And then in 1994, Oregon became the first state in the United States to legalize physician-assisted suicide for terminally ill patients through the Death with Dignity Act. And then in 1997, the Death with Dignity Act went into effect after legal challenges and changes were made to it. And then in 2008, Washington State became the second state to legalize the act of physician-assisted suicide. And then later years, over time, eventually other states picked up on this and eventually made it legal. States like Vermont, California, Colorado, all legalized it. Those were in the years of 2013, 2015, 2016. So over time, there's been a rise, increase, influx in states and other areas, like other countries, that have legalized this act. Then the controversy, of course, there's many controversies behind it, mainly because it is a doctor facilitating or helping in some sort of way for a patient to end their own life. There's major controversy because a doctor or physician, they're not supposed to have pose any sort of harm in any sort of way towards patients. There's many ethical and moral concerns of a doctor saying or telling someone to end their life by giving them prescription in a certain sort of way and fashion. The Hippocratic Oath, of course, particularly the phrase, "I will never give a deadly drug to anybody if asked for it, nor will I make a suggestion to this effect." It goes immediately, it goes right against it off the bat, because that doctor will be the one giving that deadly drug to that patient if they ask for it, or if it's the right choice for that patient. It goes right against the oath, which all doctors abide by and have to follow. This can truly affect patient to doctor connection, trust, which will have later effect, and I'll go into during the cons. How can we truly tell if a patient no longer has any hope for recovery is one question that you could ask, along with pain sensitivity from certain medications that will cause that suicide. We don't know if a patient can truly recover. So you may actually give a patient that medication ends their life, but they might have had a chance of getting better in the next months or weeks. We don't know. Or a patient actually going through pain and suffering from that medication which will cause them that suicide. Then for the pros, the 4 pros that I came up with were, it respects a patient's biological autonomy. If that patient per se wanted to end their life, end their suffering, it would respect that and allows them to do so without any sort of issue, because the doctor is signing off giving them that medication. It reduces as ends biological suffering. It would stop patients going through that pain, that suffering. It would no longer prolong it by allowing them to end their life, end their suffering right then and there. And it forces advancement in research for incurable diseases. So if we want to remove this completely, this option of physician-assisted suicide, we'd have to continue to advance in research, get a better understanding for incurable diseases, so we could find those cures for them, so that patients won't have to suffer, so you won't have to have them do something like this act where they may possibly end their life when they could get better and heal from it overall in the long run. And then it prevents extended degradation of biological function, so patients over time losing motor function, stuff like that, going from being active, maybe losing to be like paralysis, losing the ability to walk, talk, eat, stuff like that. It allows for that to not happen by ending the patient's suffering before it gets to that point. For the cons, it's a little more deep, I would say, for sure. You have slippery slope concerns, moves from allowing usage for biological / physical use. If it's allowed for that, then who's to say people shouldn't be using it for mental health uses as well? People might push and advocate for that as well, because if we allow a patient to kill themselves or have some sort of suicide based off of their suffering and their feelings, what if somebody with a mental health issue has a certain feeling and then they want to end their life? Then the topic comes to, where's the line? Is it only biological? Is it mental? Where do you draw that split? And then shift the role of doctors from not just being healers, but facilitators of death. This can have a huge effect on patients' trust in doctors, especially with patients knowing that, okay, this doctor could potentially be one that is just signed off on physician-assisted suicide. So how can you trust the medication that doctor is giving you? It causes many more concerns, because a patient's supposed to trust their doctor. They're supposed to trust their health taker, their caretaker. And if a patient knows that a doctor could just do that, how can they trust what the doctor's giving them? How can they trust their word? It makes it a little more iffy. And then you have depression from illnesses and medications. It can impair a patient's judgment. They may ask for it when they could possibly recover. This is from a patient having some sort of biological issue, disease that they are on a medication for, and it causes them that depression, and they feel like they may not get better. But in reality, they could get better, and they could possibly recover. It's just they wouldn't know, because of that depression. They might ask to have their life ended through physician-assisted suicide, and maybe the doctor checks off. And then a huge, I say the biggest one, the potential of causing lives to end early. There's a chance a patient may still be able to recover, and that patient may be going through some pain, suffering, of course, and wants to end it now. But let's say a doctor is too quick to sign off on it. Who's to say that patient wasn't going to get better in a week or a month? Where's that draw line? Which is why we need more further research on incurable diseases, because a patient may be able to recover the next day, the few days after, the week after, but the doctor already signed off on the medication, and now that's ending more lives without giving them a chance of getting better and recovering. So examples in Oregon, the Death with Dignity Act, it was first used in 1998. And since 2023, which was one of the most recent I could find, Oregon has reported around 3,000 people have used PAS since the law has made it legalized. One of the most notable cases was with Brittany Minor, a 23-year-old with terminal brain cancer who used PAS in 2014, and it brought global attention to the right and to the movement. Brittany knew she was very young. She had brain cancer and wasn't going to recover. It was eventually going to cause a loss of motor function, paralysis, couldn't eat, talk. And because of her age, her body was going to hold on. She would have been alive while the cancer ate away at her brain. And so the suffering was going to prolong, continue while she was still alive. And so after talks with her family, she decided that PAS was the best option for her to end her suffering, and she did so around the loving care of her family at her own home. For example, I know these are Advil and Alariclear, I believe. A doctor may sign off, give a prescription to a patient like this and say, here you go, take this amount of dosage, and that will end your life, end your suffering. For example, they'll be like, take 5 of these or take 4 of these. And then in doing so, the patient can either do it in hospice care, at their home surrounded by loved ones, whenever they want, really. And in doing so, they will take the pill, take the medication. It'll usually be something heavier with a higher chance of causing a death, of course. And the patient will do so, and that will cause them that suicide, which will end their suffering and their life, and no longer prolong that pain. Thank you for